In this episode of Carpe Diem.
Up to 90% of diabetes cases among Canadian adults are type 2. Today we're going to learn how you can prevent, manage, and potentially reverse your type 2 diabetes.
Carpe Diem, seizing the day for Canadians as we age.
Welcome. Today we're talking to experts on how you can defeat type 2 diabetes. But first, let's go with Leah Bolton and meet this week's Zippy Zoomer.
Okay, see you later.
Hey everyone, let me introduce Louise, our Zippy Zoomer extraordinaire for this episode of Carpe Diem.
And we're off to the vet. I've taken quite a lot of small dogs to their vet appointments, drop them off in the morning if it's a spay or neuter, and then pick them up about 3 in the afternoon. I never hide my age, I'm 80. So excited. My whole family have always had a lot of energy. Come on, sweetie. You know, I don't jog around the block and get tired that way, so, but I have a lot of hobbies, and I really can't sit still and do nothing.
I've been instructed we're putting you in here.
Okay, perfect.
So Louise brings a lot of animals in here.
Almost every working day, I think we get to see you here.
Pretty much.
That
pretty
Louise
much,
brings
yes.
in the animals from LAPS, which is really, really helpful because LAPS has to make sure that a lot of the shelter animals get to different hospitals for the treatments and the surgeries that they need each day. And if Louise didn't bring them in the morning, we wouldn't sometimes get them till the late morning or the afternoon or not get them at all.
That's great. Perfect. Thank you so much. See you later. Thanks. And since then, I was so impressed with how LAPS works and the staff and everything about LAPS that I decided to volunteer. 5 grandchildren, and when they're all growing up now, but I used to babysit them a lot when they were tiny. Here's the 3 little kittens.
Aww.
But now they're in their teens and 20s. They don't need Nana hanging around anymore. So I just got involved with the animals.
So they're doing really well.
Good. Now these little fellas have had their checkup, it's back to LAPS.
If you guys have a Zoomer to nominate, don't forget to nominate them at zippyzoomer@carp.ca. In the meantime, we're going to head back to the studio with Carmen, and we're going to get these kitties back to LAPS. Let's go.
Okay.
It's so important to stay connected as we age. Let's dive right into today's topic, diabetes. Dr. Spangle, can you tell me the difference between type 1 and type 2 diabetes?
There's a lot of different types of diabetes, and we'll talk about how it's on the rise, but essentially type 1 diabetes is probably what we first recognized, which is when children are born without the ability to make insulin in their pancreas. And so insulin levels are low, and so that's where insulin needs to be replaced. Type 2 diabetes, which is of course a lot more common, is the type of thing that most adults end up getting, and that has actually more to do with something called insulin resistance. There is incidentally also gestational diabetes when pregnant women become diabetic, which is usually reversible. And lately, because of the higher incidence of dementia and the common thread of inflammation, we're talking about type 3 diabetes, which actually leads to cognitive issues.
Dr. Spangle, you know that the rates of diabetes have actually doubled since the year 2000. And that is a very scary statistic. As well, we also know that diabetes is a chronic, debilitating disease.
Well, we can actually turn this around. We don't have to have type 2 diabetes. For most people, it's a genetic possibility, but it's like you have a loaded gun. That's your genetics. But lifestyle is what pulls the trigger, and then you can end up with type 2 diabetes.
I want to talk about this when we come back. What causes type 2 diabetes?
Still ahead on Carpe Diem.
So are you familiar with type 2 diabetes?
I was engaged to a fellow that died of it, yes. Because he didn't look after himself.
Carpe Diem. Seizing the day for Canadians as we age.
Welcome. In this segment, we're talking type 2 diabetes. What is it and what does it do to you? Let's take a look.
When you have type 2 diabetes, your blood sugar level is too high. Here's how it works. After you eat, your body breaks down carbohydrates into glucose. Your body uses sugar or glucose for energy. The glucose is absorbed in your small intestine and moves into your blood. Beta cells inside your pancreas sense that your sugar levels are rising. These cells release insulin into your blood to move the sugar into your cells, where it can be used for energy and to bring blood sugar levels down. Most cells inside your body have spots on them called receptors that connect to the insulin. Insulin acts like a key in a lock to open up the cell so that the glucose can get inside. Now your cells can use the sugar to make the energy they need to do their job. But when you have type 2 diabetes, your cells can't use insulin like they should. Over time, your pancreas stops making enough insulin. If you have insulin resistance, the insulin cannot unlock the cells to let glucose in because the locks don't work. As a result, glucose is locked out of your cells and builds up in your blood. That leads to high blood sugar or hyperglycemia. To help bring blood sugar down, your pancreas makes more and more insulin. Your overworked beta cells try to keep up with the demand, but as time goes on, they can't make enough insulin, and your blood sugar stays high.
Nafisa, how is it that over 11 million Canadians suffer from diabetes?
Well, when you look at our population, we have an aging population. We have a population where we have a very sedentary lifestyle. We're relying more on the processed, packaged foods, and the increasing levels of obesity. They all contribute to the increased levels of diabetes. But the 11 million people number includes people that have diabetes and people that have prediabetes. And that's where we actually have a chance to potentially reverse it.
The encouraging thing is that this is potentially reversible and certainly treatable. But there's literally a tsunami wave of more diabetes which is hitting us, and there's no way we can just treat it all by giving people more pills, or more insulin. When I was in medical school, I think the incidence was about 3%. Now it's generally 8%. It's going up and up. There was a big headline saying 1 in 3 kids that are born today will get diabetes. But sadly, we're seeing in high-risk populations, it's 50%, the southern United States. And even here in Canada, the Aboriginal populations, there was a headline in the Canadian Medical Association Journal recently saying 8 out of 10 of these children will get diabetes in their lifetime.
Vicente, why did you feel compelled to write this book? Like, what in your history made you attack diabetes through cooking?
Through food. My dad was actually a student with Best and Banting who got the Nobel Prize for using insulin in order to treat type 2 diabetes and type 1. And I was interested in his science. He was a physiologist, and I was also interested in preparing healthy food, which I learned from my mom. So it was a wonderful combination. Plus, I'm a Zoomer myself. I'm 76, and I'm well aware that since I've been about 60, say, I could turn things around and just start focusing on the fitness, the stress reduction, the healthy diet, plant-based, and this could really help me stay really healthy. And I'd like people to know that, because a lot of people think they have to use drugs.
You suffer from type 2 diabetes. What happens to you? How can you tell?
So we do a blood test, generally speaking, the diagnosis of type 2 diabetes. So generally speaking, if you are a high-risk group, so the South Asian community, Hispanics, people from African descent, over the age of 40 years, we recommend they get tested every 3 years.
So those are lab tests that you're mentioning, which are important. But I think what you're alluding to as well, Carmen, is how would somebody know when they're sitting at home if they have diabetes? So, I mean, typically, as you saw in the video, the main thing with diabetes is that blood sugar, which we need to put, that's our cellular energy. It fuels our brain, it fuels our heart, it fuels our organ tissues. And that fuel is staying in the blood vessels and not getting into the cells. So that's the fundamental problem. And while in the southern United States sometimes it's just called sugar, and that sugar is indeed important, it's really fat that actually results often in insulin resistance. So how do people know that they have that? They have high blood sugar levels, so they often feel thirsty. They often are peeing more. Sometimes they have more hunger. Their vision can often be blurred. So a lot of these kind of things come in that people will say, and then if there's a family history, if they're overweight or if they have other risk factors, that would lead them to the doctor in the first place.
Speaking of family, we asked you, had it touched your family? Here's what you had to say.
So are you familiar with type 2 diabetes?
I was engaged to a fellow that died of it, yes. Because
And-
he didn't look after himself.
In what way? Could you be specific?
His food and drinking.
My daughter-in-law is a severe diabetic. She's been on insulin for years, and it's affecting her kidneys. But you know, she's very overweight, and that's not good.
Diabetes has been described as the gateway illness. Is that a fair assessment?
Absolutely. I sometimes call it the mother of chronic illness. Once somebody has diabetes, they have a whole host of other medical conditions. We talk about microvascular and macrovascular complications. It's interesting that people who have diabetes, very few people actually die of diabetes. You don't die because your blood sugars are high. It happens, but it happens very rarely. You die of complications of diabetes. So we all know people who get blind, who get kidney failure, who get amputations on the leg, who get heart attacks, who get strokes.
What kind of people do you deal with on a daily basis through your diabetes chair?
So most of the population that I see are South Asians, very high risk. We also see mostly type 2 diabetes. And by the time that they've actually seen a physician, they've already gotten some of the complications. And so that's why it's really important that if you have any of the symptoms that Dr. Spankel described, the thirst, the frequent urination, those types of symptoms that you see your physician.
Fatigue is one, right?
Fatigue is the other one, yes.
What are some of the other things that somebody's sitting at home watching this and saying, well, do I have?
Well, a lot of those are non-specific, of course, like everybody's fatigued for different reasons, but that's certainly one. But I think the ones that we mentioned earlier, like the thirst, the urination, the hunger, the cravings, blurring of the vision because your blood sugars are high.
And wounds not healing that fast. Like, if you get a cut and it doesn't heal, quickly, those are some of the signals that you have.
Generally
warnings.
being sicker because your immune system is impaired. So a lot of those types of things would lead you then to, so people who have those symptoms, of course, are encouraged to see a physician where we can make
Another one is weight, because high weights, body weights, there's a big Adventist health study that was done, 60,000 people across North America, and they found that the incidence of type 2 diabetes and the rates of obesity and the different types of overweight form a very similar pattern.
And the type of weight that you talked about is important. We know that fat is pro-inflammatory, but we talk about the apple or the pear. The apple is the belly fat. And it's the belly fat that's pro-inflammatory, leads to liver problems, fatty infiltration of the liver, and non-alcoholic fatty liver disease actually kills more people now than alcoholic liver disease, and it's all as a result of the diet.
And Diabetes Canada has guidelines on the waist circumference. And they're different. They're different for a South Asian person, they're different for a Caucasian person. And when you look at that as a guide, and that's why we do the CanRisk tool assessment, which tells you if you're at risk or not, and that's on the Diabetes Canada website.
So we need people to be moving their bodies. And I, for example, have to do an hour of fitness a day, every day, like at least that. And it isn't the same every day. You don't go to the gym and lift weights. So you do things you actually like, and it takes exploring. Find out what you actually like doing, and then do a kind of cross-training thing. So it's some weights, some aerobics, some stretching, just a healthy mix of that. But that helps you keep your body in good shape.
We're going to take a short break, but before that, we asked what you had to say about your food choices.
I try to avoid sugar, and I love sweets. I love sweets. But I do try to avoid, white sugar.
Carpe Diem. Seizing the day for Canadians as we age.
Welcome back. We're discussing type 2 diabetes. Now, I want to learn how we can manage and, in fact, reverse this disease. And Visanto, that brings me to your Kick Diabetes cookbook.
You can actually turn it around so you don't have to take medicine. And how you do this is by switching more to plant foods and using whole plant foods. So that doesn't mean Coca-Cola and chips, which are plant foods. It means whole plant foods, vegetables, fruits, legumes, which are beans, peas, and lentils. These, and nuts and seeds. And so the fats you have in their diet are from things like tahini or nuts and seeds. The sweets you have in their diet are like dates if you're baking something, or fruit. And then we can really start turning things around. It's wonderful to do that.
Dr. Spangel, have you seen the results of this type of dietary change?
I have. As Visanto was alluding to, there's a program called the Complete Health Improvement Program, or CHIP, and I'm a facilitator for that program, and it essentially empowers people to make lifestyle changes which improve health outcomes. And certainly through that program, people in my practice who've been there have had high blood sugars, have been diabetic. Now, we can't reverse type 1 most times, people who are on insulin. A lot of people who have gestational diabetes, that reverses spontaneously when they're no longer pregnant. But the type 2s, if they drop the weight, if they're changing their diet, if we're reducing insulin resistance, those are all the type of things that can help this disease to turn around.
That must make your participation with diabetes kind of very exciting, because you can give everyone a recipe for success.
That's right. And one of the first things that we recommend when someone comes in is to actually try diet and exercise, right? That's sort of the key things that we recommend that people do. 150 minutes of exercise per week, throughout the week. And then, of course, having a healthy diet, like you have talked about today. And those are key components. And, of course, stop smoking, decreasing the amounts of alcohol, all those things that would help us, kick diabetes.
It sort of made a huge wave in the medical community, because you always know in medicine or in illness, you're more likely to get what you've already gotten. So if you've already had a stroke, you're more likely to have a stroke. If you've already had a heart attack, you're more likely to get a heart attack. But what made news several years ago was that people who have diabetes are at as high a risk of having a heart attack as someone who's already had a heart attack.
Well, I think a good place to start would be to ask you, do you have any questions for our panel? Let's hear what you said.
What can I do to prevent? What shouldn't I eat, and what should I do?
The increase in adult onset diabetes was, for a while in the 90s, staggering. Is that still continuing?
Let's answer one of those questions. Nafisa, you would know, are the diabetes cases increasing or decreasing?
They are absolutely increasing, and so that's sort of an epidemic, and that's why it's so important that we start doing some of the things that we've talked about today.
And some of the things we need to do are also intervening with kids. Like if you're a grandparent, your grandchildren, you want them to learn how to eat healthy stuff, not feed them chips after school or healthy or junk foods, but you want to have things like hummus, and you can make hummus quite colorful, all different varieties, and have vegetables that they dip in it. And so with just a bit of preparation, we can come up with some very, very healthy.
Raw or cooked?
Okay, this you can do either way. And one of the fun things we do is have, like for a celebration meal, a slightly steamed kale that you can make into a wreath. You just steam it a little bit, and then you can add some cranberry tomatoes or cherry tomatoes to you form it into a wreath on a pretty platter, and then put the tomatoes or chopped red peppers, and it looks that way. But you can also eat it raw. So what I suggest then is to learn how to take the you just go like that.
Ah.
Okay, but you don't want that part.
No.
Well, you can put that in juice if you want. And then you just slice it matchstick thin in a salad. So I make a salad probably about twice a week. Twice a week, but I have it every day.
We're going to take a short break. We'll be right back. In the meantime, we asked, how have you changed your diet?
I have to change my habits, and so now more fresh vegetables and less carbs.
Carpe Diem. Seizing the day for Canadians as we age.
It's now time to go around the table for our panel's final thoughts on managing type 2 diabetes. Nafisa, do you want to go first?
I recommend that people that have a family history, people over the age of 40, people that belong to certain high-risk ethnicity groups should get their screening done, and people who have signs and symptoms of diabetes do go out and seek some medical help.
But you can really turn things around, and it's good to look at some of the different resources, including Dr. Neil Bernard's website links, pcrm.org. on reversing diabetes.
I guess the bottom line that I really want people to understand is that while there's a lot of confusion and complications about diet, it can really be quite simple. I think we have to eat real food, not processed junk, not too much of it. There's a growing wisdom of intermittent fasting, not putting so much food into our bodies, which actually allows our bodies to recycle things that are already there and heal themselves, and eating mostly plant-based foods. I think that's something that we can agree on, and I don't want to discount the fact that people need to see their physicians. There are a lot of complications of diabetes we mentioned, and also sometimes medications are required. We use oral medications, in particular something called metformin, other medications as well, and certainly insulin. So I think that while our goal as clinicians, or some of us who like doing lifestyle medicine, we like to try to take medications away from people, but the bottom line is making sure that they hit the targets, that their risk factors are managed, and that they have fewer complications in order to live long, healthy, and productive lives.
There's so many reasons to follow your cookbook, and before we say goodbye, I need to try one of those little cranberry tomatoes. But that's the show. Remember, as our Carpe president, Moses Neimer, always says, the best way to keep going is to keep going. So stay zippy and Carpe Diem, seize your day.
Thanks. I'm gonna have to